Welcome back to my channel. Don't forget to subscribe, like, and watch my videos. Today I'll be talking about signs and symptoms of HIV and AIDS. HIV, human immunodeficiency virus. Symptoms can vary by stage of infection. Alright? Symptoms can vary by stage of infection. And many people have no noticeable symptoms for years. AIDS is most advanced stage of HIV infection and has more severe signs. So I will be teaching you stage by stage breakdown of the signs and symptoms of HIV and AIDS. Alright. Early HIV infection, that is the acute HIV. It is the first stage of HIV infection, and it's usually appearing 2 to 4 weeks after exposure to the virus. That is the acute HIV, the first stage, when HIV enters your body. 2 to 3 weeks. There are some common signs and symptoms that appears when HIV first enters your body. Alright. Although the virus, when it first enters your body, your immune system reacts, and many people develop flu-like symptoms such as fever, chills, sore throat, lymph nodes, skin rashes, muscle aches, fatigue, night sweats, mouth ulcers, and headache. These symptoms usually last few days to a couple of weeks and may be mistaken for the flu or other viral illness. Alright, some people have no symptoms at all. Some people have no symptoms at all. They have no HIV symptoms. And not every fever is malaria. Not every fever is malaria. Unless you get tested. And not all these signs are HIV signs unless you get tested. Alright? And AIDS is most advanced HIV infection. When we talk about acute HIV, that is the first stage of HIV, we're talking about chronic HIV infection as well. The stage that comes after the acute stage, that is the chronic stage. It comes after the acute stage. HIV slowly damages the immune system in the chronic stage. It develops slowly. The CD4 cells, that is the immune cells, gradually decline in the chronic stage. It's a gradual process, gradually declines. The person can still transmit HIV to others without even developing the signs and symptoms. You can harbor it and transmit to others. You understand? So in this chronic stage, it's possibly mild, because a chronic HIV may not cause obvious symptoms. Testing is the only reliable way to know. In this chronic stage, you have signs like persistent swollen lymph nodes. They are there. You have occasional fatigue. This moment you feel strong, the next moment you feel sleepy, you feel weak, even after resting for a long period of time. You sleep for hours. When you wake up, you feel fatigue again. You have minor infections that happen more often than usual. Many people feel normal during this period, which is why testing is important. Advanced HIV and AIDS. When the immune system becomes severely weakened, more serious symptoms appear. Common signs and symptoms like rapid weight loss, prolonged fever, extreme fatigue, heavy night sweats, chronic diarrhea, persistent cough, shortness of breath, recurring infections like pneumonia or thrush, mouth, genital and anal sores, memory problem and confusion. Frequent or severe infections happens when it advances to AIDS. People with AIDS often develop opportunistic infections or certain cancer because the immune system is too weak to fight them. So this is why testing is important. So in my next video, I will be talking about testing for HIV. How it is important to test for HIV, because some people might harbor the virus in their body and might not even know. So this is why testing is important. When you get tested and know your status, you'll be more at ease. When you get tested, you will know how well to go about it, even if you are infected. Thank you.